All right, thanks so very much. Well, stroke is the third leading cause of death, but you may not know this. It is also the leading cause of long-term disability. But a quick, painless screening could save your life in the fight against stroke. With more on this, we welcome Dr. Mike Davis. Great to see you this morning.
Good morning, Whitney.
Thanks, Mike. Vascular surgeon. He does all kinds of wonderful things. But this has been an amazing tool. How's it work?
What we're doing today is actually showing you how the ultrasound test used to image the carotid artery. It's the blood flow through the artery that leads to the brain. It's an extremely sensitive and specific test. It can tell us with a very high degree of accuracy if there's a problem there. And using that information, then we can then guide the patient as to appropriate treatments and referrals.
Yeah, okay. Liz is going to do this on me, so let's get started. Gosh, I haven't had, seems like I remember this from being pregnant, all the ultrasound equipment and stuff. But
no needles, no x-rays, no pain. The test takes just a few minutes and is extremely helpful.
And what are you looking for in here?
Well, we're looking for the evidence of plaque or hardening of the arteries. The carotid artery is one of those places in the body where it's very common to occur. And the implication is that when it occurs in this area, complications include causing a stroke.
When you screen people, any idea what the percentages are of people who will have a problem?
I can't give you an exact number, but it depends on the population that we're screening. If people have the appropriate risk factors, such as high blood pressure, high cholesterol, and family history and history of smoking, in that population, it's actually very high. Probably exceeds 50%.
Well, you all are doing a free screening. Now, look, that looked almost like a weather map to me. They're going to explain what we're seeing here in just a second.
We sure will.
In fact, can you look at the data now to see?
What we're seeing on the screen right now, Liz is looking at a color image and color representing blood flow through the artery, and fortunately you're clean today, Whitney. You don't have any problem there.
All right, that's interesting. You know how the red kind of starts and stops? Is that my blood pumping?
It is. It's a graphic representation of the blood flow through the artery based on the sound waves being reflected back into the probe.
Just amazing how science has done so many things. You're going to be doing this for free, aren't you, coming?
We are. We're going to do this with the Baton Rouge General at Bluebonnet on Thursday at 5:30. It's an appointment only, so we encourage people to call, and we're looking for people that have risk factors, people with a history of high blood pressure, high cholesterol, a family history of either heart or carotid disease, and those who are smokers, and particularly those people over the age of 45.
Which is awfully young, but evidently the closer I get to it, the younger it seems, let me tell you. 45 and beyond.
45 and beyond with those risk factors.
But they do need to register.
They do need to register. We need to be efficient at this process, because we can run a lot of people through there. We need to know who's coming and when they call to register, they'll get a time to come.
Great, and it's from 5:30 to 7:30 on Thursday night, February 3rd, and they'll book you there. And as Mike mentioned, you know, it takes just a couple of minutes, but they need to bring people through in an orderly fashion.
Absolutely, and it's you know, it can really make a difference in some people's lives.
Thanks so very much. Dr. Mike Davis, vascular surgeon here in Baton Rouge. Appreciate you joining us today.
Thank you very much.
And Liz, thanks for your help. Didn't hurt a bit. Stay tuned, more tuning coming up right after this.